Hey guys, today we're going to be talking about a sensitive topic that happens as we get older, but it's not a normal part of aging, and that is overactive bladder. And what occurs is your bladder muscles will tighten on their own without having an actual full bladder. So your bladder muscles have their own set of rules on that, and they're doing something that your mind is actually not triggering for them to do, which creates urgency or a need to go to the bathroom when really you don't have to go. There are two general symptoms that occur. One is urgency, which is where you think you necessarily have to go, and in fact you might have to go, but it's not because of a full bladder. Again, it's because of those muscles tightening up around the bladder. And the second is frequency, and by definition of frequency, it is more than 8 times per 24 hours or 2 times at night when you've already gone to bed. So you're waking up having to go to the bathroom 2 times during the night. Either one of those would qualify you under frequency. It can be accompanied by urge incontinence. And when that happens is your muscles tighten up so fast that you cannot make it to the bathroom in time, and you do get a little dribbling that occurs with that. Again, something with that, it's a muscle related issue with the muscles around the bladder, and you can do some treatment for that. As far as causes, number one, the biggest cause is unknown causes, where they really can't pinpoint what's going on. But there are some other things. An enlarged prostate is one thing in men. You can have bladder stones, bladder cancer. A lot of neurological things go on with it, like if you've had a spinal cord injury, dementia, multiple sclerosis. Also with that, you can have issues where physiologically, your build, your physical makeup, as you've aged, it's not responding as well to urinating as it once did. And so that's something that they could actually look at with surgery on that. Other issues could be urinary tract infections, which happens a lot, especially in women, and medications. There are a lot of medications out there that can actually cause this problem. So it'd be good to talk to your pharmacist or doctor if you're experiencing it, because that's an easy fix. As far as risk factors, what are some of the things that make you more prone to it? Well, it occurs more in women than in men, and it occurs generally more commonly after the age of 50. However, it is not a normal part of aging like a lot of things are. If you're a diabetic, you're going to be more prone to having this issue. An enlarged prostate also will put you at risk. Dementia or any kind of spinal cord injury will also cause you to be at risk for this as well. Then the amount of caffeine and alcohol that you are taking in daily can put you at risk. So you want to definitely watch out on both parts there, because if it's something that can be prevented just by what you're taking into your body, by all means, let's do it that way without taking medications. As far as problems that it causes, it's not a life-threatening condition whatsoever. However, it can cause depression, obviously, anxiety. If it happens at night, it can cause sleep issues, which then leads to bigger problems like cardiac health and high blood pressure. It can cause increased urinary tract infections and skin infections in the perineal area. And it can cause issues with your sexual performance as well. So how do we prevent it? Like I said, this is one of those that I'm kind of excited about, because there are a lot of things to help with this. First and foremost, decrease your alcohol and caffeine. Stop smoking. Regular physical exercise. Those top 3, pretty doggone easy to do. Number 4, decrease your weight. The amount of weight that occurs in the stomach area, the waist area, is actually putting extra pressure on your bladder and on those muscles. If you can take that off, it will help those muscles. Manage your conditions. If you have diabetes, keep your blood sugars in check. If you have BPH or benign prostatic hyperplasia, make sure you're taking your medications and seeing your doctor regularly to keep your prostate size down where it should be. Kegel exercise, which are pelvic floor enhancing exercises. Basically with Kegels, you can do them anywhere, anytime. You're basically just squeezing your cheeks together as you would to shut off the stream of urine as you were peeing. So if you do that 25 times a day, that's going to help out. If you can do it even more than that, that's great. Nobody even knows you're doing it. So the more that you do that, the more that those muscles get built up. Then also, if you can time your bathroom schedule, so if you can set up a schedule where you can extend the length of time between you going into the bathroom to urinate, that will help to build those muscles and trigger them so they're not spasming on their own and producing pressure on the bladder to go pee when you really don't have to. You want to pee when your bladder is completely full or almost completely full. So if you're going 10 times during the day, just when your muscles are saying, hey, we got to go, but yet you went an hour ago, you haven't drank anything, you know you really don't have to go. Try and set yourself on a bathroom schedule so you can get it down to less times per day, but more quantity each time. Your stream will also be fuller and stronger, which will help out as well. Try increasing by 15 minutes at a time. Obviously, you don't want to have an accident, but you can build up where if you were doing 10 times a day, to cut it back to 3 times a day. In severe cases, catheterization can help. You want to talk to your provider about that because you will be the one or your significant other actually inserting the catheter on that. As far as medications, in women, especially if you've gone through menopause, vaginal estrogen can help to strengthen those tissues and muscles up. And you can get them in creams, suppositories. The creams now are much cheaper than they once were. Talk to your doctor about that. Remember, you've got to stay hydrated with those, and they will make you prone to headaches. Most of them make you prone to sensitivity from sunburn as well. Some other ones, and I'll use the brand names basically so it's easier for you to remember. Toviaz is one that's out there. Vesicare, Trospium, Myrbetriq, Detrol, and then an older one that is out mainly in generic is oxybutynin. You want to remember with all of those, they can really cause things like dizziness, constipation, can affect your vision a little bit as well. Dry mouth, dry nose, dry eyes, which is why you're using it, is to dry the bladder out. The best one out of those as far as side effects is Myrbetriq. It just now came out in generic, but it is kind of expensive, so talk to your provider or pharmacist about that. Botox is also injected to help relax the bladder muscles, but if you're using Botox, they will also require you to use catheterization as well, so be aware of that. If you do have a severe case, that might be an option for you. There are also 2 types of nerve stimulation out there. One type is one that is like around the clock. Kind of works kind of similar to a pacemaker for the heart, except it's in the bladder. The second type, you actually go into the provider and you get a stimulation once a week for 12 weeks. Then they back it off to doing it once every 3 to 4 weeks, depending on how you do. That might be a better option for you because you're not hooked up all the time around the clock. And of course, the last option that's out there is a surgical option where they can go in, and this is for the people that physiologically you just have a small bladder, and there are a lot of those out there that do. They go in and they physically increase the size of your bladder to help you so you can go longer throughout the day.